So let me get my screen share here. Right here. Okay. Can you see that okay? It says join Weston A. Price Foundation.
Yes.
Yeah.
Okay, good. So the reason I put that in there was because this information that I'm getting on this blood pressure was written by a medical doctor who goes by the name of a Midwestern doctor. And he has done that for several years because he has been putting out information that's been contrary to the narratives, and it keeps whatever state he's in or whatever medical board from going after him. So he's an anonymous guy, but he puts out a lot of good information. So what I'm recommending people do is join the Weston A. Price Foundation. It's $40 a year, or you can go to Wise Traditions Podcasts on Apple Podcasts. There's a code, and I think the code is Weston 10, Weston 10, and you join for $30 a year. And then you can listen to the podcast, which I highly recommend. And there's the link there. So if all goes well, and this is all recorded, then it'll be out there for people to pull that off the screen there. So the book that I'm referring to is this book. It's actually it's one of their quarterly magazine in the winter 2024 edition of Wise Traditions, and it talks about the great blood pressure scam. And I'm just going to go through this and give you data so that you can make a decision about whether blood pressure is important to you, whether it's as important as people have made it out to be. And I'm not telling you to get on blood pressure medication or get off blood pressure medication. I can't do that. That's not in my scope of practice. But you as a human, as a person, as a patient, you can do whatever you want. And you're in charge of your own body, and you can make the decisions for yourself. Doctors are there to help you, give you information, give you opinions, but you have to remember that you're responsible for your own health. So this article was in this edition of Wise Traditions, and some of the things that I thought were important in this article. It's a very long article with lots and lots of references, so it's very well referenced. It says, whenever a drug existed that could treat a number or statistic as the years went by, the acceptable number kept on being narrowed, making more and more people eligible to take that drug. In fact, many of the dogmas that underlie popular drugs are actually sales slogans created by a marketing company. And I think in today's climate, nobody should be surprised about that. And then low serotonin has never been linked to depression. That study just kind of blew the whole SSRI treatment for depression out of the water in 2024. Acid reflux is due to too little acid in the stomach. Well, that's not what most people are told, but that's true. Sleeping pills are sedatives that block the restorative phase of sleep. That's true. And we say that rising blood pressure damages arteries, or instead, does the damage to the circulation in the arteries raise blood pressure? Which is it? And most of the time, people are never have a conversation with their doctor or health provider about that. So I think it's worth having that discussion. So, we look at some ideas about why do we want lower blood pressure? Well, we're told that if we keep our blood pressure lower, we'll lower our risk of death from cardiovascular disease. I mean, really and truly, most people don't care about what their blood pressure is. They care about what kind of an effect it might have on their longevity, the quality of their life and their health. They really want to live longer, and they don't want to die early from a heart attack because of high blood pressure, because that's what we've been told. So the idea of lowering blood pressure equals longer life, right? And this is a universal assumption, and the key word in that is assumption, that it exists, that lowering blood pressure is good And a related assumption to that is that a drug can lower blood pressure. If a drug can lower blood pressure, it must be good and should be approved. And there was a 2020 study of over 400,000 elderly patients above age 75 that looked at an SBP, which is systolic blood pressure, that's the upper number, below 130, significantly increased the chance of death, and a diastolic blood pressure below 80, a common consequence of blood pressure medications, made patients 8 to 19% more likely to die. So that's not what we're told. We're told just the opposite. The more you lower your blood pressure, the better you're going to be. And then there was a smaller study of 800 adults over the age of 60 that found that diastolic blood pressure, the lower number, below 80, made participants 90 to 190% more likely to die. And once again, a systolic blood pressure under 120 was associated with a higher risk of death. That is opposite of what we've been told and what most people believe. But these are studies, and unfortunately, if they don't fit the idea, the popular idea, or the narrative, then they just get ignored or brushed to the side. There was a UK study, United Kingdom study of 17,000 people aged 35 to 64 that went on for about 10 years. And that study showed that treating high blood pressure made no real difference in the likelihood of a coronary event. There was almost no difference in the death rate, 253 versus 248 deaths, or a 0.06% reduced chance of dying. I wouldn't take those odds to the racetrack and bet on a horse with those. And they said that when the blood pressure craze took off, there was a rush to bring blood pressure lowering drugs to market before there was actual proof of their benefit. And as the years have gone by, the blood pressure thresholds keep getting lowered without supporting evidence, and more people are put on medication. Roughly today, 60 million American adults. In 2017, the American Heart Association and the American College of Cardiology reformulated their guidelines, setting 130 rather than 140 as the new high for systolic blood pressure, the upper number. So rather than 1 in 3 US adults having high blood pressure, 32%, with the previous definition, the new guidelines will result in nearly half of the US population, adult population, 46%, having high blood pressure or hypertension. And then this is the AMD there from AMD. That is a Midwestern doctor who I mentioned at the beginning. He says, I and many of my colleagues believe that one of the most underappreciated causes of hypertension is anxiety. Frequently, effectively addressing anxiety can resolve a case of high blood pressure, which would otherwise receive pharmacologic treatment, often indefinitely. And a question that I don't think many people ask their physician is, what's your plan to get me off of this drug for whatever the drug is, for whatever the condition is? I mean, the idea is not to have everybody on drugs. I mean, that's the idea that the drug companies have. But as a patient, you would want to know, like, okay, what's your plan to get me healthier and off of this so they don't have to have that? So this is, again, referring to a Midwestern doctor and his colleagues, says each one of us came to a similar conclusion. The increased blood pressure must be a compensatory mechanism the body is using to counteract the fact that it can't get enough blood to where it's needed, which again is recognized to occur with the kidneys. Second, the health of the cardiovascular system depends to a large extent on the lining of the blood vessels being able to secrete nitric oxide, or NO, which in turn dilates or makes bigger the blood vessels, locally decreasing blood pressure and regionally increasing blood flow. Defective production or activity of nitric oxide, which leads to endothelial dysfunction. Endothelium is the inside layer of the blood vessel, typically precedes the development of atherosclerotic plaques or hardening of the arteries. So we're going to get in a little bit on the nitric oxide as well. And is much more severe by the time they're formed, as the surface of the endothelium has calcified at that point. For this reason, Many believe the core issue is not calcification of the arteries or high blood pressure, but rather endothelial dysfunction, which in turn leads to abnormal growth of endothelium and formation of harmful blood clots. Given that endothelial dysfunction happens to increase blood pressure, that again argues that the direction of causality for heart disease is incorrect. Third, whenever the body is not getting enough blood, a sympathetic reflex will be triggered to increase the blood pressure. For example, this is commonly seen in critically ill patients or those who have rapidly lost a significant amount of blood, at which point the blood vessels will tighten and the heart rate will increase. The tissues on the other side, like if the blood is coming from this side, let's say the heart is here and the blood is going this way to the tissue cell, if you start lowering the amount of blood that can get from the heart to the tissues, then the tissues start to suffer. So yes, we've lowered the blood pressure, but the tissues aren't getting the supply that they need of oxygen and nutrients. So the tissues start to malfunction. And that's why so many people say the only time that I really feel good is when I don't take my medicine, because the cells are getting what they need. This is a term that sometimes was quite common a while ago, but I haven't heard it very much lately. But polypharmacy just means a lot of pills. In 2007, an important Israeli study titled "The War Against Polypharmacy" found that discontinuing an average of 2.8 drugs per elderly patient reduced their one-year death rate from 45 to 21% and their hospitalization rate from 30 to 11.8%. Just from taking them off drugs. Okay, so again, I think it's a really good question to ask a physician, like, what's your plan to get me off these drugs? Because I don't want to be on these for the rest of my life. I want to work on being healthy. And then there's this under recognition of side effects, like, yeah, that's normal, or that's just common, or that'll go away. But a 1982 study, which would not be repeated in today's political climate, and this again is a Midwestern doctor speaking, that compared how patients, their families, and their doctors felt about the effects of these drugs. 40%, 48% were taking beta blockers, 25% were beta blockers plus diuretics, and 12% were diuretics only. When asked whether quality of life improved, stayed the same, or became worse on the blood pressuring drugs, 100% of the doctors answered improved, referring to their patients, versus less than half, 48% of patients thought that, while 99% of relatives assessed their loved one's quality of life as worse. So, like, what happened to Uncle Joe? He used to be like so full of energy and, wanted to go do things. Now he just wants to sit around and watch TV. That would be like a relative's assessment of their, somebody in their family. And 9% of the patients agreed with that assessment. So obviously the relatives could see it, but the patients couldn't. So the patients were kind of buying what the doctor had said 100%. Oh, you're doing better. Okay, well, he says I'm doing better, so I guess I'm doing better. But the people around watching the situation see what's really going on. Most relatives characterize the worsening as moderate, 45%, or severe, 30% of them, with commonly cited deterioration, including an undue preoccupation with sickness, irritability, and a decline in energy or general or sexual activity. So their level of activity is just going lower and lower and lower and lower, and it's a creeping kind of thing. So oftentimes it isn't sudden, and so the people don't notice it, but the people around them notice it, or the people who maybe haven't been around for a year or 2 or 6 months, and then they show up again, and they go like, "Gosh, what happened to Uncle Joe?" And this is, again, why does this happen? What factors can explain this inexorable march toward putting everyone on these drugs? My best guess is that this is due to some combination of the following. Research funding is available for those areas, that is, from the drug manufacturers, meaning that it is a safe area for academics to explore. Well, if you followed anything that's been happening in the last 6 years, maybe, of, or maybe even four years, having gone through COVID, anybody that was doing any research that was contrary to the common or preferred narrative was defunded, kicked out, lost their hospital privileges, would found out they'd never get another grant again. You only get grants from somebody who agrees with what you're going to study. And so if you're studying something that is like um, out of the orthodox, out of the narrative, well, you're not going to get granting. You're not going to get any grant money. And so your whole career depends on doing grant money, and so does the longevity and the financial health of the institution that you're working with. He said it also illustrates the if you have a hammer, everything looks like a nail phenomenon and the medical profession's desire to find more justifications for using its tools. Experts, quote unquote, on guideline panels are paid to create recommendations that result in more people taking the drugs. And then he talks about in the article that he wrote on the Great Cholesterol Scam how that happened with statins. And then, oh yeah, let's not forget about salt. Most people have heard that you have to reduce your salt intake. Well, here's a fact. Low sodium levels are strongly correlated with a risk of dying. Specifically, the salt consumption target we are told to follow increases one's risk of dying by 25%. So, as a patient, what is a patient supposed to do? Like they get all this conflicting information between a study, maybe that they found that they read, like, well, my doctor never told me this, or what the doctor's telling them, or they go to one doctor and he tells them something, and then another doctor says, well, you don't really need to be on all these pills. And so they get, the patient comes away just befuddled. They don't know what to do. And they're the ones that ultimately suffer. We're supposed to be here serving patients, serving people, and trying to get people healthy. So the answer is get your body healthier. And here's some suggestions that I'm going to recommend. Um, simple, simple lifestyle measures you can do. And most of these are quite inexpensive to free. And if we view much of the hypertension as being a disease of the arteries, there are a few ways to restore the pliability and health. So what you want is you want arteries that can expand and contract and expand and contract vigorously like this. And the more pliable they are, the healthier are. The stiffer they are, the sicker they are. First, weakened and inflexible vessels can be the result of nutritional deficiencies, most commonly not enough manganese or zinc. In both cases, we use standard process formulations, manganese B12 taken every other day or zinc chelate taken daily to effectively strengthen the blood vessels. This is a medical doctor talking. This is not me, a chiropractor talking. This is a medical doctor speaking. In many cases, the issue of a magnesium deficiency, magnesium allows blood vessels to relax, which makes it one of the most well-known natural blood pressure therapies. Use magnesium lactate or Easy Mag from standard process. And to find out your zinc level, if it's adequate or insufficient, there's a test you can take called a zinc sufficiency test, and then you can also muscle test for the amount or dosing of that particular supplement. The zinc sufficiency test is you just drink, you hold the zinc tally test liquid. It's basically water with some mineral in it, and depending on how you taste, a little bit, a lot, not at all, will tell us whether you're zinc deficient or zinc sufficient. It's very simple. And the test takes less than a minute. You can test your nitric oxide or NO by these strips. This is, I just took a picture of the one that I use. This is called Human N, and you buy it online. I got these off of Amazon. And so it's just a little strip, like a pH strip, and you take put some saliva, take some saliva from your tongue, and you put it on the strip, and you see the color that it changes. And then there's a scale to see if you're, inadequate, low, or if you're adequate in your nitric oxide. which remember that has lots to do with how healthy your endothelium is, the lining of your blood vessels. Um, Next, you want to eliminate chronic infections or addressing inflammatory components of the diet. So tests that you can do, like lab tests for inflammation, there's C-reactive protein, CRP, or erythrocyte sedimentation rate, or SED rate. So they're usually referred to as CRP or SED rate. So that would be something that you want to include on a lab test. There's an omega-3 status test. That's a little finger prick blood test to see, are you getting enough omega-3 fats in our body? Omega-3s are super important because you need them to mount an anti-inflammatory response. And we use those up every single day, so they have to be replenished on a daily basis. Um, and you have to have those omega-3 fats to balance out the seed oils, which if you look down on that bottom of that slide, eliminate all seed oils, sunflower, safflower, corn, cottonseed, canola, soy from your life. Okay. They dramatically interfere with mitochondrial function in your cells. Um, they were never meant to be eaten. They were cheap oils that were used to lubricate machinery. Canola, there's no canola plant. It comes from rapeseed. Um, but canola stands for Canadian oil. It's a They use it on lawnmowers and machinery to lubricate them. So it's not supposed to be in the human body. Plus the way that they're excuse me, the way that they're processed, it's under high heat and pressure. It's pretty nasty. It just denatures all these oils. And so you just want to get them out. You want to be a label reader, like avocado oil is good. It's kind of popular now to find um, different foods that are using avocado oil or olive oil, coconut oil. Those are good oils. Butter. Um, and addressing anti-anxiety or excessive stress component in many cases, just simple relaxation effort exercises such as deep abdominal breathing through the nose can help increase your parasympathetic tone and relax the nervous system. We're going to talk a little bit more about parasympathetic tone in a minute. Getting out in the sun, fixing one's sleep cycle, exercising, regularly practicing a relaxation technique, and cleaning up the diet to reduce insulin resistance and high blood sugar and increase potassium and magnesium. Improving one will often improve the others. So you get this multiple effect from doing one thing better. And by the way, the sun is not your enemy. The sun doesn't give you cancer. The sun actually gives you a stronger cellular configuration in those cells. You make vitamin D from the sun. Vitamin D is one of the major hormones in the body. It's called a vitamin, but it's really a hormone. But it's so preventative in so many things that you want to get out, for 20, 30 minutes a day in the sun. Here's a few ways to increase your nitric oxide in your body. Eat beets. Take beta food supplement from Standard Process, which is basically beet top juice, the greens of beets. Eat citrus fruits, eat leafy greens, and you can also supplement that with Standard Process Power Mix, which is about, I think it's, if I'm remembering right, it's like um, 14 different greens. It's really, really good. You just mix it in with water or coconut milk. Eat walnuts, almonds, and pecans. Um, and depending on where you're from, you either call them pecans or pecans. Um, I always get corrected on that because I grew up, they were pecans. But my wife always corrects me on that. Pecans. However you want to say it, you know what I'm talking about. It's kind of interesting too when you look at a walnut. Um, yeah, it's a walnut. Crack it open, it looks like a brain, you know. Heart rate variability, not heart rate, but heart rate variability. It measures the balance between your parasympathetic or growth, healing, and repair system and the sympathetic nervous system, fight or flight. There's this, the quote that I have here is from this article, um, Low Heart Rate Variability and Sudden Cardiac Death. And this was taken out of this article from one of the medical journals. It said the findings provide additional evidence that cardiac parasympathetic function is depressed in patients prone to development of sudden cardiac death, SCD, and that altered autonomic function, which is the automatic or um, part of the nervous system that's running in the background, altered autonomic function contributes to the development of electrical instability in such individuals. This accords the findings that such risk factors for sudden death as coronary artery disease, myocardial infarction, congestive failure, and hypertension, high blood pressure, all have been associated with reduced parasympathetic activity or attenuation of parasympathetically mediated reflexes. So parasympathetic and sympathetic are like the brake and the gas, the yin and the yang, the positive and the negative. We have to have both running, but your sympathetic system, which is your fight or flight system, should be on restful readiness to jump in when needed. It should not be firing when you're doing your normal daily activities. It's there to get you away from the dog that's chasing you, to get you out of the way of the bus that you weren't paying attention. You stepped into the street and then you have to jump back onto the sidewalk. That's its job. Um, the parasympathetic nervous system is there for growth, healing, repair, love, creativity, all the good stuff. We're supposed to live our life in the parasympathetic balance part of the nervous system 99.5% of the time. And then the sympathetic fight or flight is only supposed to be in the picture half of 1% of the time. But they found when your parasympathetic function goes lower and lower and lower, your risk of sudden cardiac death goes up and up and up and up. So how would you know what your parasympathetic sympathetic balance is? Wouldn't you like to know? Well, there's one way that you can do it, and I do it. It's an app in your phone. It's one of the phone apps that you can get. Like there's an app for everything, but this one is the best one that I've found. It's the largest, it's the most widely used one in the world. It's called Elite HRV. And you just go into the Apple store, the App Store, and look up Elite HRV. It's a free download. Download it to your phone. And then it works off there's a few different heart monitor straps. I use a Polar H10, but if you go on the Elite HRV site, they have a list of apps that are compatible with, or a list of heart rate straps, monitors that are compatible with the app. So the cost on this on the Polar H10 is about $100. And this one particular one, the H10, will also connect up to like machines that you have at the gym, let's say a treadmill, a rower, a stair climber, all those things that have that heart monitor function in them. It'll take it off of those, and they're dramatically more accurate than a watch or the grips that you hold on to on the rails on a treadmill or something like that. So the reading on the left where you see an 8 where there's kind of a blue ring around it, that's an 8 out of 10. That's one of the readings that I took that I had the other day. I do these pretty much every morning. It takes about 2 minutes to do the reading. It gives you your heart rate. If you can see on this one, my heart rate's 55 and my HRV is 66. So, what does that mean? Well, if you look at an age range, an HRV score of 66 puts me in the somewhere in the 25 to 35 and the 18 to 25 range for health in your cardiovascular system, your autonomic nervous system, parasympathetic, sympathetic balance. So me personally, I put a lot more credence on that than what a blood pressure reading is or some other test. This is a functional test that you can do on yourself on a daily basis. You do it in the morning before you get up and run around. It's not a resting heart rate because resting heart rate is you need to take that when you're laying down in bed before you ever get out of bed to go to the bathroom. If you go to the bathroom, forget it. It's not your resting heart rate. Your resting heart rate is when you're laying down and you either take your beats for a minute for 60 seconds here, like on your neck or on your wrist, or you take that heart monitor strap that we just showed you, that red one, and you just put that across your the lower ribs, and you just put a little saliva on your finger and just wet the contact points on either side of the pickup and just lay it there. But you have to reach over, like without moving, reach over, grab the strap, just lay it on there, and you can just put your hands on top of that and hold it so you're like with your hands on your chest like this, and just lay there. And then that's going to be your resting heart rate. Once you get up, you don't get an accurate resting heart rate. You have to do it while you're still laying down. So that 60, that 55 is not my resting heart rate. My resting heart rate is lower than that. But just for point of reference, those are that it's a great way to keep track of what your real nervous system health is that's affecting your cardiovascular system. Um, and then maybe the most profound thing you can do is get yourself cleared out, adjusted here. So this is a study that's looking at this is the skull here, right here. This is the top bone, the atlas. This is the axis. This is C3. This was a study that was done at the University of Chicago Hypertension Center, where they looked at adjustments to the atlas, the top bone here. And I'll give you the gist of it. What they did was there was um, there was a medical doctor, and if you look at this slide, it says the study. That's a QR code that you can scan. It will take you to the paper and the study. The interview is one of the, I think it was an evening show that the lady from the TV, the interviewer, she's interviewing the chiropractor that did the adjusting, Marshall Dick Holtz Sr. He was an older, been in practice for like 60 years. And then Dr. Backus that did the study, and then the other doctor, and I'm not remembering his name right now, but he was the doctor that referred his patients, a medical doctor referred his patients to Dr. Dickholz, the chiropractor, so that they could do this study. And basically, they had 50 patients that he referred over that had high blood pressure. 25 of them got what they called a sham adjustment, some sort of like pushing around on the neck. And the other group, 25, got an actual upper cervical adjustment like we do here in this office. And the results were that the people that got the chiropractic adjustment to the first vertebra, the atlas, had results in lowering blood pressure that the researchers said was better than 2 blood pressure medications given in combination with no side effects. And one of the researchers says, well, we just couldn't believe that, but when we looked at the data, there it was. It was true, right? And so this was done back, and I believe it was 2007. But you probably never heard of this on Good Morning America. Well, actually, they actually, part of this, there's an interview, and if you pull this up, Robin, what's her name? One of the hosts of Good Morning America, she's on this show, and she's interviewing the medical doctor that they had, Timothy, whatever his name is. and they actually had this on. So like, wouldn't this be a great thing if we could, if we could adjust people and their blood pressure would get lowered from a simple adjustment and they wouldn't have to be taking medication. Wouldn't that be wonderful? And he said, yes, but we need more study and, blah, 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 blah. But it was, we see that all the time. And so people need to know about this. So if you can pass this study on, if you can pass people on the link, it's really quite amazing. And one of the amazing things on this, when you look at the TV interview, the medical doctor that had referred the patients over to the chiropractor said he's been doing this for a number of years. And he said, I think the number of patients that I've referred over to Dr. Dick Holtz, the chiropractor, was about 6,000 patients. That is a lot of people that a medical doctor would be referring over to a chiropractor. But he did it because he saw the effects that it had on his patients and how much better they did. So that is a really, really important study. And if you want to find out more about like eating in the traditional way, it's another plug for the Weston A. Price Foundation. Dr. Price was a dentist who went around the world in the early 1900s and studied all the native tribes and peoples of the different, from all the way from the Alaskan tribes down to the people in Switzerland, the people in the Philippines, to the Maoris in New Zealand, all over the world, and studied how they lived and how much real native food made a huge significant difference in their health. That book is called Nutrition and Physical Degeneration. That's the book right there. Um, and he had pictures of people from all these different areas of the world. And this was done decades before there was ever anything called blue zones. And he basically laid down that if people were eating their native foods, unadulterated, unprocessed foods, they were healthy the way God intended them to be. And it's really about traditional foods and traditional ways of eating, which produce the healthiest people um, that have ever lived on the planet. And we really need to do that because we have one of the sickest countries on the planet. So I'm all for the Make America Healthy Again, because if we don't, we're going to be in big trouble. So those are the links to get onto the Weston Price. I really encourage you to join them. It's only $40 or $30 a year. And you get this vast compendium of information that you can help you and your family be healthier. So I hope you enjoyed this. We'll do this again sometime soon. And thanks for being on with us. Bye for now. Thanks for being here.
Thanks, Doc. I
You bet.
appreciate that.
Good.
Thanks, Dr. Charity. Take care.
Trying to figure out how to get off of here. Okay.